talk about Chapter 3, Neurobiology and Pharmacotherapy. So functions and activities of the brain. So mental wellness is an outcome of a properly functioning brain. And brain function can be impacted by neurobiological factors, which is your nervous system, or even environmental factors. The functions of the brain are maintenance of homeostasis, regulations of autonomic nervous system and your hormones, control of biological drives of behavior, cycle of sleep and wakefulness, circadian rhythms, conscience, mental activity, memory, as well as social skills. You can review pages 38 through 40 in your textbook about what each of these systems do. So let's talk a minute about neurons. Let's get there. Sorry, I'm scrolling right past it. Here we are. So neurons are cells that are prevalent in the brain. Neurons respond to stimuli, they conduct electrical impulses, and they release neurotransmitters. The neurotransmitter is a neuromessenger that crosses the synapse and attaches to receptors. Neurotransmitters allow the interaction between neurons. This interaction is a major target of drugs used to treat psychiatric disorders. There is a table on page 41, 3.1, that's very helpful. And there's also going to be a chart on our next slide. So neurotransmission reuptake is the process in which neurotransmitters are reabsorbed by the synapse that created it. And then deactivate and inactivate, this is the process of inactivating neurotransmitters through enzymes such as monoamine oxidate. As you can see, here's a list of several of the neurotransmitters and what they do in our body. I would be familiar with these. Now, the organization of the brain, you're going to review this one on your own because this goes back to your anatomy class. So let's talk about our case study, a lady named Eleanor. Eleanor, a political science professor, comes to the community clinic complaining of lack of sleep. She speaks slowly, hesitating to think before she answers questions. And her partner, Doreen, who has brought her here, is obviously worried. Eleanor smiles at Doreen. "I just need something to help me sleep. I'll be fine." We know that Eleanor has come to the clinic for help with sleep. Which function of the brain controls this? The answer is C, circadian rhythm. Now, as the assessment interview progresses and Eleanor demonstrates more slowness and difficulty answering questions, Doreen takes her hand and explains that Eleanor has been having more difficulty with memory lately, both in small things, like whether she just ate lunch, and in bigger things, like what she was in the middle of discussing during a classroom lecture. Which part of the brain is most responsible for Eleanor's difficulty with delivering her lectures and remembering whether she has eaten? The answer is B, the cerebrum, and you can reference that on page 44 of your textbook. So, visualizing the brain. Modern techniques in imaging have become important tools in assessing molecular changes in mental disease and marking receptor sites of drug action. An electroencephalography, EEG, assesses electrical signals in the brain. Structural tests show the anatomy and structure of the brain, such as with a CT and an MRI. And then functional studies show physiological activity of the brain, such as a functional MRI, PET scan, or SPECT scan. You can see figure 3.6 and 3.7. For examples of PET scans on patients with depression and with Alzheimer's. So disturbances in mental functions. Most origins of mental illness are unknown, but can be related to genetics, neurobiology and neurotransmitters, environment such as infection or trauma, and also lifestyle such as prescription or recreational drugs. So action of psychotropic medications. So let's go back to pharm here. Pharmacodynamics, this is what the drug does to the body. Pharmacokinetics is what the body does to the drug, and this is where you include absorption, distribution, metabolism, and excretion. Pharmacogenetics is the effect of genetic variation on drug responses. And then drug agonism refers to mimicking the natural effects of neurotransmitters by binding and stimulating the receptor. Drug antagonism refers to blocking the receptor and obstructing its action. If you do not have a firm foundation right here in these core concepts, you need to go back to your pharmacology notes and review this. So let's talk about anxiolytics. Anxiolytics treat the manifestations of anxiety. And then there's some drug class exemplars here. The first one, and one of the biggest ones we'll talk about this semester, are benzodiazepines. They are the most prescribed medication for treating anxiety, as they regulate the function of the neurotransmitter GABA, refer back to earlier slides, causing anti-anxiety, hypnotic, anticonvulsant, amnestic, and muscle relaxant properties. Your examples of benzos are here: diazepam, alprazolam, lorazepam, temazepam, and chlordiazepam. Most of the benzos, as you can see, end in the suffix pam. These are all controlled substances, and they do have the potential for misuse and for abuse. Buspirone is a commonly used medication for chronic anxiety. It is not a benzo, but it is a partial serotonin receptor agonist, which does not affect the GABA receptors. It can take several weeks to see clinical effects. On page 51, you can see your bullet points here for the differences in buspirone versus benzos. And then antidepressants. We will go into more detail on these medications, but they have been deemed the first-line treatment for anxiety disorders. They're preferred over benzos due to long-term use, the lack of misuse, and ability to treat anxiety and depression concurrently. But then there are adverse effects. Your benzos, you have sedation, poor concentration, impaired memory, and drowsiness, so this makes the patient a fall risk. And benzodiazepine toxicity can occur, but there is a reversal agent. It's called flumazenil. Buspirone adverse effects include sedation, nausea, headaches, and dizziness. So we do need to educate our patients. We need to teach them not to consume alcohol or other central nervous system depressants, because they need to be mindful of these sedation effects. They need to know that dependence and addiction can develop, and they do not need to abruptly discontinue. They must taper off of these medications. This slide here is a slide you're going to want to be very familiar with throughout the entire semester. So miscellaneous anxiolytics. You have your short-acting sedative hypnotic sleep agents known as Z-hypnotics. These drugs have sedative effects without the anti-anxiety, anticonvulsant, or muscle relaxant effect that you get from benzos. These also have a faster onset of action, so they should be taken when you're actually ready to go to sleep. These are things like Solpadeine, Saloplan, and Esopiclone. Then you have your melatonin receptor agonist. Melatonin is a naturally occurring hormone in the body that promotes a normal circadian rhythm. Our example here is Ramalation. Ramalation is approved for insomnia when the patient has difficulty falling asleep. It is not a controlled substance, so there is no potential for abuse. Doxepin. Doxepin is approved for insomnia when the patient has difficulty staying asleep. It is also not a controlled substance, but you need to avoid it if a patient has urinary retention, glaucoma, or if they're taking those MAOIs. And then you have orexin receptor antagonists. They promote wakefulness, and they're approved for insomnia with difficulty falling asleep or staying asleep. Our example is Suvorexant. Suvorexant is a controlled substance, and it is contraindicated in patients with narcolepsy. So antidepressants. Antidepressants are used to treat a variety of manifestations that present in depression and anxiety. And this includes major depressive disorder, bipolar disorder, generalized anxiety disorder, as well as PTSD. So the first drug class we'll talk about are your monoamine oxidase inhibitors, those MAOIs. These are rarely used, and they're considered a last line of treatment due to multiple interactions and dietary restrictions or tyramine. So foods high in tyramine should be avoided and include aged cheeses, so think Swiss cheese and blue cheese, processed meats like hot dogs, sauces like soy, and dried fruits like raisins. The most common side effects include weight gain, daytime sedation, sexual dysfunction, and insomnia. Our prototype here is selaglutide, and it is the only antidepressant available in a transdermal patch. Then you have your TCAs, your tricyclic antidepressants. These are no longer considered the first-line treatment since the development of SSRIs due to the numerous side effects of TCAs. They have a longer action time, and they're more lethal. They have a more lethal overdose potential. TCAs block the reuptake of norepinephrine as well as block the reuptake and destroy serotonin. Our example here is amitriptyline. The most common side effects include dry mouth, constipation, and orthostatic hypotension. Next are the selective serotonin reuptake inhibitors, SSRIs. They block the reuptake of serotonin, and they are a first-line treatment for major depressive disorder as well as anxiety disorder. Our example here is venlafaxine. The most common side effects include nausea, agitation, and sexual dysfunction. And then you also have your serotonin norepinephrine inhibitors, SNRIs. Your SSRI examples are fluoxetine, sertraline, and escitalopram. Your example of your SNRIs is venlafaxine. So SNRIs work by increasing both serotonin and norepinephrine. The main side effects are similar to SSRIs, but it also includes appetite suppression. And then you have other medications. Esketamine is only available as a nasal spray and only performed by a healthcare provider. It's not for home use. It is approved for the treatment of depression after 2 failed antidepressant trials and should be used in combination with an oral antidepressant. Brexanolone is the first medication approved for postpartum depression. It is a controlled substance, and it is administered by infusion over 60 hours. Again, this is a slide that will follow you throughout the entire semester. I would become familiar with it. Mood stabilizers are used to help relieve manifestations of mood dysregulation found in disorders like bipolar disorder. Lithium, we'll talk about lithium a lot this semester, but lithium is the primary medication in mood stabilizers, but the properties are not well understood. However, it can help prevent a relapse into manic or major depressive episodes. Serum levels must be checked every 1 to 2 weeks when initiating treatment until a therapeutic level is obtained. But lithium toxicity can occur if the level is greater than 1.5. Other side effects include diarrhea, nausea, increased thirst, fine hand tremors, as well as weight gain. Anticonvulsant medications. They're used if lithium is not tolerated, and they have been approved to treat bipolar disorder and reduce mood swings. The main side effects will be sedation, dry mouth, and weight gain, or possibly weight loss. And you can see your examples here. So antipsychotic medications, or neuroleptics, are used to treat a variety of manifestations that present in schizophrenia, spectrum disorders, and other psychotic-related disorders. So you have your first-generation antipsychotics. They're very potent dopamine antagonists that work by blocking the dopamine receptors. They are helpful in treating severe manifestations of schizophrenia and positive symptoms like hallucinations and delusions. Now, they do have concerning side effects, but commonly people will exhibit dry mouth, constipation, blurred vision, and orthostatic hypotension. Weight gain and sedation are also of concern, and you also need to monitor them for those extrapyramidal syndrome and tardive dyskinesia. Our example here is Haldol. So our second generation, or atypical antipsychotics, work by blocking the dopamine receptors to a lesser degree and by inhibiting the reuptake of serotonin. Again, they are often a first-line treatment, and they treat positive and negative symptoms, which we will discuss when we discuss schizophrenia later this semester. They are less likely to produce those extrapyramidal symptoms. Again, we will discuss a little bit later, and they're less likely to produce tardive dyskinesia. There are metabolic side effects such as increased blood glucose, increased blood pressure, and increased cholesterol. Our examples here are olanzapine, quetiapine, and ziprasidone. So medications for attention deficit hyperactivity disorder, ADHD. Stimulants. Stimulants can be used to treat ADHD or even narcolepsy. With stimulants, you see an improvement in reduction of hyperactivity, impulsivity, and inattentiveness. It is a controlled substance with the potential for misuse or abuse. It can have side effects that include insomnia, increased blood pressure, increased heart rate, decreased appetite, agitation, and even growth suppression. Our examples here are methylphenidate and amphetamines. And then you also have your non-stimulants. They're not as effective as stimulants, and they're not controlled substances. And you see your examples there. So medication treatment for Alzheimer's disease. Treatment has been unable to prevent or slow the structural degeneration of the brain in an individual with Alzheimer's. So you have your cholinesterase inhibitors. They slow down the destruction of acetylcholine. You see our examples here on the slide. All three of these examples are approved for mild to moderate Alzheimer's, while donepezil and rivastigmine, which is a transdermal patch, are also approved for severe disease of Alzheimer's. Rivastigmine is also used to treat Parkinson's dementia. Then you have your NMDA receptor antagonists. They are approved for moderate to severe disease, and they're often added to cholinesterase inhibitors with progression. So we talked about this in pharm, but herbal remedies may interact with prescribed medications and can cause harm to the patient. So we always need to ask about any over-the-counter and herbal remedies the patient may use. Major concerns can include the fact that many lack adequate safety and efficacy data. There's lack of regulation by the FDA, and they may not always contain the active ingredient that's displayed on the bottle or on the label. So Eleanor is treated with a blank, which helps to slow the destruction of acetylcholine. The answer is D, a cholinesterase inhibitor, because they show some efficacy in slowing the rate of memory loss. This chapter is going to be a key chapter in understanding everything we talk about in mental health. So you need to not only memorize the chapter, you need to understand the chapter.